A Cape Town couple has been arrested after allegedly killing their own child. Reports suggest that the 8-month-old infant died in hospital last week after he was allegedly brutally beaten. Now, there have been similar cases of this nature not only in South Africa but globally. What drives parents to not only turn on their own but to brutally murder them? To understand the psychology behind that, we're joined now by clinical psychologist Ruth Ancer from the Private Healthcare Centre. Ruth, thank you very much for your time this afternoon. We know people in South Africa and across the globe have been facing incredible pressure amid the COVID-19 pandemic. But could societal and economic pressures related to the pandemic be enough to push a parent over the edge to kill their own child?
Hi. No, I think that, first of all, obviously I can't talk about this couple because I don't know the circumstances. But just in general, there would have to be quite significant personality problems. And often in cases like this, we see that there's the influence of substance abuse. Often, parents or adults involved in hurting children have either been victims themselves or have seen this kind of violence happen in their own families. So in terms of role modeling, there have been people brutalized by what they've seen, but I think it's a combination. There also has to be kind of a severe level of pathology in terms of a lack of empathy, no impulse control. And I think also very important is the lack of social structures and supports. So, we have a society where people are very much left alone. We have very inadequate resources. So where there are stresses, there isn't support. So that in itself isn't enough. But when you have a combination of all these factors, it can contribute to the kind of devastating incidents like that happened in Cape Town.
We have to recognize the humanity in even the most inhuman acts. So how can we find empathy or at least some form of understanding for parents who kill their children? Because that's key to intervening and to preventing these kind of situations.
I think there are different reasons. There are people who kill their children when they feel the sense of desperation and they feel they're protecting their children. It doesn't sound like this is the situation here, and it sounds like this was as a result of terrible abuse. So I think it really does depend on what is going on for the people involved, and it's very hard to feel empathy when you see that actions that appear that are so very cruel and are very inhumane, but circumstances are different, and it really does depend on a variety of factors. But it is incredibly worrying that we live in a society where there is so much violence, towards children, towards women, and men towards men as well. And I think that that's a continuation. But what is so horrifying for us is the fact that it's against a baby who's so defenseless and depends on adults around them to protect them. So that's what makes it really, really difficult to understand. But, it's a combination of factors that result in this, and it's very, very devastating.
Once again, speaking very broadly and not specifically about this case, there are clinical psychoses which could lead a parent to brutalize his or her own child. Do many of these go undiagnosed in underprivileged communities?
I would imagine so, because there's so much, there's so much, mental dysfunction and there's so few resources. There are long waiting lists at clinics, and also the interventions aren't effective because facilities are so under-resourced. So that is sometimes what happens, that it could be a psychotic episode, and often there is substances involved, and there might be a history of violence between the parents or history of violence within that person. It's very unlikely that this would be the first time that whoever committed this, this assault on this baby, it's very unlikely that this was the first time they've been violent. There's likely to be a history of reduced impulse control and aggression.
So we live in times when now more than ever we have to look out for each other. Communities are very reliant on each other to report abuse to the necessary healthcare and social structures. What are warning signs, clear warning signs that a child is in danger?
I think we need to recognize that part of the problem is that we don't have a solid structure. You know, families are not, they don't have the extended support that they should have. So people might actually recognize there's something happening, but they don't know what to do. So, but if you see warning signs, are when you see people behaving in really aggressive ways to their children, or you see people who are using substances but still looking, you know, supposed to be caring for children, that is when you need to reach out to institutions in the community, either churches or the police or the welfare department. The problem is we don't have a society where the institutions are as responsive as they should be. But certainly if you suspect, you do need to do something. In fact, it's a criminal offence not to intervene, certainly for professionals and teachers if they suspect that there is abuse going on of any kind. But for concerned neighbours and concerned family members, certainly to reach out at least to a police station and ask what the steps are that you can take.
Well, thank you very much for speaking to us. That was Ruth Ancer, a clinical psychologist from the Private Healthcare Centre. And certainly, don't be afraid to speak out. You have to get involved. We all have to get involved.